Lateral interbody fusion, also known as an X-lift or a D-lift. What does it mean? Lateral means you're going from the side to take out the disc space, put in a spacer with bone to get the fusion, which means get the two vertebral bodies to grow together, which can stop the pain and pinching of the nerves causing people's problem. So basically, we put the person on their side, the whole abdomen falls forward, which makes it less invasive and safer, especially in larger people. We go in between the pelvic bone and the ribs. L2-3, L3-4, and L4-5 are generally pretty easy to get to because most of those bony structures are out of the way. There's a risk with any surgery. The risk of this surgery is you have nerves that can be in the way, blood vessels in the front, your intestines and your organs can be in the way. There's always a risk with any surgery. But overall, if you do this surgery systematically, it's a very safe, minimally invasive surgery that typically takes us about 30 to 40 minutes. So what we do is we put somebody on the side, everything falls forward, make an incision. Bluntly, we go straight down. We go in front of the psoas muscle, pull it back, put a retractor in. We do neural monitoring to make sure the nerves are okay. Then we take the disc out, get all the cartilage and soft tissue out, release the soft tissue to get the disc to open up. Then we put a plastic spacer, sometimes metal, sometimes bone, across the disc space, which distracts the bones open to get the height back. So as we get older, the disc degenerate and collapse down. Putting it in the spacers opens it back up to get the height back, which also opens up the holes for the nerves. The typical type of spacer we put in looks like this. The ones we use are typically actually bigger than this, and they really provide a lot of stability, height restoration, and a lot of surface area to get the bone to grow. And we put bone and different types of proteins into the spacer to get the bone to grow through there. So the first putting the spacer in takes about 30 to 40 minutes on average, sometimes longer. Then we also got to add more stability though. It's like when you break your arm, you want to put a cast on it to stop the motion to let the bone grow. So these spacers we have found sometimes are stable enough, but typically we add more stability to them. Typically we're going to add screws and rods and lock it in place. These pedicle screws and rods we typically put in with a computer navigated 3D system that shows us the spine three-dimensionally, so we can put the screws in through a very minimally invasive and safe approach that preserves the muscle supply and blood supply, especially to the other joints. And putting the screws in typically takes about 30 to 40 minutes as well. And that's for a 1 level. 2, 3 levels, it typically takes a bit longer. So there's risks with any surgery, risk of injury to nerves and blood vessels and organs, and putting the screws in has a risk of injury to the nerves. But overall, this is a very safe, reproducible surgery that we do a lot of, and it's done all over the world. Results of the surgery, typically people's pain averages around an 8 out of 10 before the surgery, and averages around a 3 out of 10 after the surgery. So if you're at an 8 out of 10 and in agony and unable to walk and stand and do basic things, getting down to a 3 out of 10 can really fundamentally help people. That 3 out of 10 also means some people are at a 1, some people are at a 5. And so the average is a 3. Most people have some pain and stiffness, but they're typically a lot better than they were before the surgery. There's other risks and complications that you can go over in person with your surgeon. You have a couple options at this point. One is if you want to come and see us in person, please call 310-448-7890 for an appointment. Or if you want to email us at info@watkinsspine.com, we can reach out and help you. Thank you.